Is sepsis contagious? I get this question all the time, and it's a totally valid concern, especially when you have a loved one who's sick. So let's get it out of the way right now. The simple answer is no. You can't catch sepsis from someone, but, and this is a huge but, the full story is more complicated. While sepsis itself isn't contagious, the infections that trigger it definitely are. Today, we're going to talk about how to protect yourself from the common germs that can lead to this terrifying condition. First things first, let's get on the same page about what sepsis actually is. Lots of people think it's just a really bad infection, but that's not quite right. Sepsis is the body's extreme, life-threatening response to an infection. Here's an analogy I use with my patients. Imagine your body is a large building and a fire breaks out in one room. That fire is the infection. Normally, your immune system acts like the building's sprinkler system. It activates, puts out the fire in that one room, and the damage is contained. But with sepsis, the sprinkler system goes completely haywire. It doesn't just put out the fire, it floods the entire building, causing massive, widespread damage. That out-of-control flood is sepsis. Your own infection-fighting processes literally turn on your body, causing your organs to shut down. This isn't a small problem, it's a full-blown medical emergency. It starts with an infection. That infection triggers sepsis, and if it's not treated immediately, it can spiral into severe sepsis and then septic shock. That's when your blood pressure plummets and vital organs like your lungs, kidneys, and liver start failing. The statistics are just staggering. Globally, sepsis affects an estimated 49 million people and causes 11 million deaths each year. That accounts for 1 out of every 5 deaths worldwide. In the United States alone, at least 1.7 million adults develop sepsis annually, and tragically, at least 350,000 of them die during their hospitalization or are sent to hospice care. The mortality rate is high, and for septic shock, it can be as high as 40%. This is why knowing how to spot and prevent it is so powerful. So, back to our main question. Now that you know sepsis is your body's internal haywire reaction, it's easier to see why you can't catch it. Sepsis is a syndrome, not a germ. You can sit with someone who has sepsis, you can hold their hand, you can care for them. You will not get sepsis from them. It doesn't travel through the air or through touch. Think of it like a severe allergic reaction to a bee sting. The bee venom is the trigger. That's like the initial infection. One person gets stung and has a little itchy bump. But another person might have a massive body-wide allergic reaction called anaphylaxis. Their airway swells, their blood pressure crashes. It's a life-threatening emergency. You can't catch anaphylaxis from them. It's their body's unique extreme response. Sepsis is the same idea. The infection is the trigger, but the septic response is your body's own dysfunctional overreaction. 2 people can get the exact same flu virus. One person gets over it while the other's immune system goes into overdrive and develops sepsis. It's all about the body's response, not the germ itself. While sepsis isn't contagious, the germs that cause it, the bacteria, viruses, and fungi, absolutely are. This is what you have to understand to keep your family safe. The secret to preventing sepsis is preventing the initial infection. The overwhelming majority of sepsis cases start from a pretty common infection. The most frequent culprits are lung infections like pneumonia, urinary tract infections, skin infections from cuts or wounds, and infections in the gut. For most healthy people, a cut on the finger or a case of the flu is just an annoyance, but for some, especially those with certain risk factors, that simple infection can be the match that lights the forest fire of sepsis. We'll now walk through these common infections and talk about exactly how to stop them. Let's start with one of the biggest sources of sepsis, lung infections, especially pneumonia. A huge chunk of sepsis cases, often estimated between 30% and 50%, start in the lungs. While pneumonia itself isn't contagious, the germs that cause it are. The viruses and bacteria responsible are passed around through respiratory droplets. When someone who's sick coughs, sneezes, or talks, They spray tiny, invisible, germ-filled droplets into the air. If you're nearby, you can breathe them in. Those droplets also land on doorknobs, phones, and keyboards. Touch that surface, then touch your face, and you've just given the germs a free ride into your body. This is why colds and the flu spread like wildfire in offices and schools. Let's think about a guy named David, a 70-year-old who loves playing with his grandkids. One of the kids gets a simple cold. David catches it, but because he's older and has a bit of lung trouble, his cold gets worse, not better. The virus moves into his lungs and causes viral pneumonia. His body struggles to fight it. He starts breathing fast, gets a fever, and feels confused. All early signs of sepsis. The infection has triggered that haywire immune response, and he needs a doctor right away. David's story is scary, but so much of it is preventable. Here's how to build your defense. First, vaccination. For many people, certain vaccines are an important layer of protection against the infections that can sometimes lead to sepsis. This includes vaccines against flu, COVID-19, and RSV, depending on your age and health conditions. It's also worth knowing about the pneumococcal vaccines. These are designed to protect against a type of bacteria that can cause serious pneumonia and blood infections, especially in older adults and people with other medical problems. In the UK, for example, they're routinely recommended for all young children, adults over 65, and some younger adults with specific long-term conditions. I'm not here to tell you what you personally must do. Everyone's situation is different. What I do recommend is having an open, honest conversation with your doctor or specialist about which vaccines are and are not appropriate for you. Ask about the potential benefits, the common side effects, and how they fit with your own medical history. The goal is not to scare you into anything, but to make sure you have the information you need to make a decision you feel comfortable with, together with a professional who knows your health in detail. Second, master your hand washing. I can't say this enough. Wash your hands with soap and water for 20 seconds, especially after being in public and before you eat. If there's no sink, use an alcohol-based hand sanitizer. And get in the habit of coughing or sneezing into your elbow, not your hands. Third, be aware of your environment. Wipe down high-touch surfaces, especially when someone at home is sick. And yes, wearing a mask in crowded indoor places during flu season is still a fantastic way to avoid breathing in germs. Fourth, stay healthy. Smoking wrecks your lungs' natural defenses, so quitting smoking and avoiding secondhand smoke is huge. A little known tip, good oral hygiene. Brushing and flossing regularly gets rid of bacteria in your mouth that can be accidentally inhaled into your lungs. Next up, skin infections. Your skin is your armor, but any break in it, a cut, scrape, burn, or bug bite, is an open door for germs. A common troublemaker here is a bacterium called Staphylococcus aureus, or staph. Lots of us carry it on our skin or in our nose without any issue. But if it gets into a wound, it can cause a nasty infection that spreads easily through skin-to-skin contact or by touching contaminated items. This is a big deal in places like gyms and for sports teams. Think shared towels, razors, or athletic gear. A super dangerous version is MRSA, which is resistant to many standard antibiotics and much harder to treat. Let's take Jessica, a college soccer player. She gets a turf burn on her shin. No big deal, she thinks. She rinses it off and forgets about it. But later, she uses a towel that a teammate with a small boil also used. The MRSA bacteria on the towel get into her turf burn. In a few days, her shin is red, swollen, and painful. The infection spreads up her leg. She gets a fever and feels terribly sick. Her skin infection has gotten into her bloodstream and triggered sepsis. Jessica's ordeal started with a tiny scrape. Preventing this comes down to two things: great wound care and smart hygiene. First, treat every break in the skin seriously. If you get a cut, wash it right away with soap and water. You can add a little antibiotic ointment, but the most important step is to cover it with a clean, dry bandage and keep it covered until it's healed. This is your shield, and whatever you do, don't pick at or pop sores. That just pushes the bacteria deeper. Second, don't share personal stuff. This is a hard rule, especially in high-risk places like locker rooms. No sharing towels, razors, or uniforms. If you use bar soap, switch to liquid soap, since bacteria love to hang out on a wet bar. Third, build smart hygiene habits. Always wash your hands after touching a wound. Shower right after working out to wash away any bacteria from shared equipment. At the gym, use a towel as a barrier between your skin and the benches and wipe down equipment before you use it. Now for UTIs. They're another very common source of sepsis, especially for women, but they spread differently. For the most part, UTIs are not contagious in the way we usually think about it. You can't get a UTI from a toilet seat or by touching someone. UTIs usually happen when bacteria that are already in or on your own body, most often E. coli from your gut, get into your urinary tract. Because a woman's urethra is shorter and closer to the anus, it's just an easier trip for the bacteria. While sex can increase the risk by introducing bacteria into the area, it's more of a relocation of existing bacteria, not a transfer of an infection from your partner. The main exception is in healthcare settings. In hospitals, bacteria can be spread on things like urinary catheters or by the hands of staff if they aren't following strict hygiene rules. Since UTIs are usually an inside job, prevention is all about good habits. For women, one of the most effective habits is to always wipe from front to back. This simple action helps keep bacteria away from the urethra. Stay hydrated. Drinking plenty of water dilutes your urine and makes you go more often, which helps flush bacteria out of your system before they can set up shop. And on that note, don't hold it for long periods. Urinating after sex can also help wash away any bacteria that got moved around. And if you're in the hospital, be your own best advocate. If you have a catheter, ask your nurse or doctor every single day if you still need it. Getting catheters out as soon as possible is one of the best ways to prevent hospital-acquired infections. The other big category is infections inside your belly caused by things like a ruptured appendix or a perforated bowel. Bacteria from your intestines leak out, causing a massive infection that often leads straight to sepsis. While a condition like appendicitis isn't contagious, some of the stomach bugs that cause severe vomiting and diarrhea certainly are. They're usually spread when germs from an infected person's stool get onto hands, surfaces, or into food. This is why relentless hand washing after using the bathroom and before cooking is so important. If you have a stomach bug, don't prepare food for others and be extra careful about cleaning the bathroom. Anyone can get sepsis, but some people are definitely more vulnerable. It's important to know if you or a loved one are in a higher risk group. These include adults 65 or older and babies under 1 year old. People with weakened immune systems like those on chemotherapy or with HIV. People with chronic conditions like diabetes, kidney disease or lung disease. Anyone who was recently hospitalized or had major surgery. And importantly, anyone who has survived sepsis before is at a higher risk of getting it again. If you're in one of these categories, all of these prevention steps are even more crucial. If you're finding this useful, and I really hope you are, please take a second to hit the like button and subscribe. It tells the algorithm that this is important information and it helps more people find it. So let's recap the most important points. First, sepsis itself is not contagious. It's your body's own out-of-control response to an infection. Second, the infections that trigger sepsis, like pneumonia and skin infections, absolutely are contagious. Third, you have the power to protect yourself. Prevention is your best weapon. That means diligent hand washing, staying up to date on vaccines, and taking great care of any wound, no matter how small. And finally, my most important message for you is this. Learn to recognize the signs of an infection and act fast. If an infection isn't getting better or is getting worse, you need medical help. Don't wait. If you ever feel that something is seriously wrong, or you see a combination of symptoms like fever, confusion, rapid breathing, and severe pain, get medical help immediately. When you do, don't be afraid to say the words, "I'm concerned about sepsis." It could save a life.